Hello, I'm Zach,
And I'm Cole.
and we're going to talk about probiotics today. So, what is it? Probiotics are live microorganisms. Yeah, that's right. They're called good bacteria. They're taken orally to treat disturbances in normal bacterial flora. The bacterial flora is a community of natural bacteria that lives in the body and maintains a mutually beneficial relationship with the host. For example, flora in the intestinal tract have metabolic functions that mediate the synthesis of vitamins and absorb calcium and magnesium. Good bacteria can also keep the bowel clean, break down food, help make B and K vitamins, and suppress bad bacteria. Yet other types of bacteria will prevent inflammation and enhance the effects of the immune system. Bad bacteria damages gut walls, causes infections, putrefaction, inflammation, flatulence, bad breath, and can stop absorption. When the bacterial flora become disturbed, it can cause diseases like diarrhea, yeast infections, atopic diseases, which are a group of diseases linked by compromise in the immune function, ulcerative colitis, IBS, celiac disease, and Crohn's. It can also have an effect on obesity and type 2 diabetes. Probiotics improve the intestinal and urogenital microflora and prevent the proliferation of diseases causing bacteria or fungi. What are the effects of it thought to be? So there are many different types of bacteria that can be classified as probiotics, but most come from two groups, lactobacillus and bifidobacterium. Lactobacillus is the most common and is found in yogurts and other fermented foods. This helps with diarrhea and the digestion of lactose. Bifidobacterium is found in some dairy products and it helps with IBS. So how does it work? Probiotics are known to replace the good bacteria that is lost after taking antibiotics. Dr. David Williams explains the process well. The normal pH of the colon should be between 6.7 and 6.9, which is slightly acidic. The acidic environment promotes the growth of good gut bacteria and inhibits the growth of pathogenic bacteria. Antibiotics, most common, the ingestion of chlorine and over-the-counter drugs can make the colon environment more alkaline. Examples of over-the-counter drugs that interfere with good bacteria include painkillers, analgesics, steroids, anti-inflammatories, sleeping pills, birth control pills, antacids, and vaccines. Probiotic supplements introduce friendly bacteria, which changes the pH to become more acidic. As the colon's pH changes, there is essentially a tug of war between the good and the bad bacteria, which causes symptoms including stomach grumbling, gas, loose stools, and other bowel symptoms. So, who wants to use a probiotic? Patients who present to the clinic with the following disorders would benefit from the use of probiotics. So, clostridial infection, constipation, diarrhea, IBS, oral thrush, traveler's diarrhea, urinary tract infection, vaginal yeast infection, and patients who need a dietary supplement. Probiotics are most commonly used to suppress the effects of diarrhea.
So, what are some side effects and adverse reactions of probiotics? Here it is. You're going to have gas and bloating. Those are the two most common side effects, and realistically, according to the research and what we've read, there are not a lot of adverse side effects with this. In people with underlying health conditions, probiotics has been known to cause unhealthy metabolic activities, too much stimulation of the immune system, and gene transfers or insertion of genetic material into a cell. Therefore, we would advise that you consult a doctor before the use of probiotics. There are also good side effects. Many people taking probiotics experience overall high energy levels and better digestive function. Um, Another thing to take into consideration is that the effects from one species or strain will not necessarily be the same as other strains. So it's important to do some research on that as well. According to popular demand, you can buy this stuff over the counter pretty much any retail store in the country. Um, According to this site, U.S. sales of probiotic supplements and products are growing steadily, totaling 1.4 billion in 2014 and are expected to reach 3.1 billion in 2020. Um, so, looking at some of the research done, probiotics are used to promote a multitude of effects. The Mayo Clinic College of Medicine researchers are examining the effects of probiotics on decreasing levels of certain substances in urine that cause kidney stones. There's a research study going on at the New England Medical Center that's studying the effects of probiotics for the treatment of antibiotic-resistant type of bacteria that causes severe infections. Um, Kumar and Singhai and colleagues proposed a literature review and studied the effects of probiotics in critically ill children. The evidence suggested that enteral supplementation of probiotics reduced the incidence and severity of necrotizing enterocolitis and all-cause mortality in preterm infants. They also found in critically ill children that probiotics are effective in the prevention and treatment of antibiotic-associated diarrhea. So we see that probiotics can be effective in treating bacterial strains of digestive infections. Um, so are the effects of probiotics similar to any other drugs? Um, it is considered a supplement. Its effects are similar to the ingestion of some specific foods. Some examples of foods containing good bacteria would include miso, which is a soup made from fermented soy, yogurt, which contains the common strain Lactobacillus, sauerkraut, which is fermented cabbage mixture, kombucha, which is fermented tea, and kefir, I don't know if I'm saying that right, which is fermented milk commonly found in smoothies and ice cream. So what we're trying to tell you is that instead of going to Costco and spending an absurd amount of money on probiotic supplements, kick back with a few ballpark franks loaded with some sauerkraut at a much lower price and receive the same kinds of bacteria. Obviously, going to be getting that in much lower doses with that food. So recommendations to your family. If a family member comes up to me and asks, should I be taking a probiotic? We would most likely recommend their use, but some specific factors would need to be revealed. Uh, the use of probiotics would be dependent on the symptoms present. So if a family member was suffering from digestive issues such as irritable bowel syndrome, constipation, diarrhea, or possibly urinary tract infection/yeast infections, probiotics would most likely be recommended. The popular demand of probiotics and evidence supporting its effectiveness for treating digestive symptoms are reasons that they should be recommended. And one final reason for a recommendation would be the incredibly significant absence of side effects. So in conclusion, and our opinion is the benefits of probiotics greatly outweigh the risks. And of course, we would have the family member consult their physician before using the supplement. So hope you learned something about probiotics today. Thanks for joining us, and we'll see you guys next time.